It's that time of year again. Time to find a Medicare plan that's the best fit for you. Annual election period. That's what this time of year is for. Forget Thanksgiving and Christmas. It's all about the annual election period. But first, don't start by asking your friends or going online shopping for the best plan without first understanding how to evaluate what you need. I mean, the old-fashioned way is you're going out there trying to find the best plan for yourself without really understanding how the best plan for yourself looks like. So let's first figure out how to take all the plans that there are available to you and take all the needs that you have and try to best fit them together versus trying to figure out what the best plans are and then fitting your needs to it. That doesn't make any sense to you, right? Doesn't make any sense to me. So traditionally, during the annual election period, you go to sales seminars. You may ask your friends and family what Medicare plan they might be looking at for next year. You might see an agent sitting down at the local pharmacy, a CVS or a Walgreens or a Walmart, and you might discuss with them what kind of benefits their plan has. But that's kind of the wrong way. It's kind of like looking at all the choices you have to eat at the wrong restaurant. What you need to do is you need to first figure out what you want. How do you find the best fit for you if you don't first evaluate what those things that matter to you are? Well, I've written a book and I've distilled kind of these 6 metrics that matter on a Medicare Advantage plan. Now there's a whole ton of things that, of course, matter when it comes to medical coverage, but there's really only 6 things that we have really control over as far as choice. All the benefits on a Medicare Advantage plan are the same. So as long as you find a reputable company that has a really good track record, who, if you have to go in battle with, probably wouldn't want to fight you because you could go to the press and say how bad they treated you. So if long as we kind of push those companies out of the way and choose the ones that are more reputable, that kind of can narrow it down a little bit on the plan choices. After that, there's really 6 metrics that matter. The first metric that matters is the plan type. Are you interested in an HMO plan or a PPO plan or something else? Next is the network inclusion. Is it really important to you that your doctors are in the plan, or are you willing to sacrifice your doctors to get the plan that will save you the most money and have like the best benefits as far as costs? Also along that same line, is it important for you to have a close vicinity to hospitals, physical therapy centers, urgent cares? Is that important to you? I know you can go outside of the network to get emergency and urgent care, but think about this. From that point, after they stabilize you, if they have to send you to a hospital that's 30 or 40 miles away, you will have to pay for that entire trip and the hospitalization at the hospital that you have that's in network. So that's, to me, pretty important metric that should matter. The next 2 are premium and copay. And I separate them because premium is the amount of money you spend per month, right? What that typically does is it buys down certain copays and co-insurances that you have. Although in some cases, the premium actually buys up certain additional benefits like dental, vision, hearing, or certain other kind of extra benefits. So you have to really see if those benefits that you're buying with your premium dollars actually make sense to you. And that's where the copay and co-insurance comes into play. What services do you utilize all the time on or with your medical insurance? Also, what are the services that are really expensive? How much does it cost for a hospitalization for a week? How many physical therapy appointments will you have next year, and how much do each of those individual visits cost you? How much is an ambulance ride? These things are the more expensive copays and co-insurances on Medicare plans. So you should see on the plan, if you're paying a premium, are those copays going down relative to kind of what everyone else is charging? Number 5 metric that matters is the drug plan. So all Medicare Advantage plans that include prescription drugs have a formulary and have a tiering system on how much they charge for each drug. Plug in your drugs and find out not only is the premium and copay the right amount for you and the doctors the right fit for you, but if the drugs are saving you the most money. is the drug plan that's attached to this plan that you like, does it cover all the medications that you need at a cost that you can afford? And the last thing are the extra benefits. Things like dental, vision, hearing, gym memberships, healthy food cards, etc. There's a whole ton of them. And how important are those things to you? The way I like to think about this section is, are there any benefits like that that you are currently using? And how important are those benefits to be included in your plan for next year? Could you join a plan that doesn't have gym membership, instead pay for the gym membership out of pocket? If dental is something that you need, is there a dental plan that is equivalent to the one you currently have on your Medicare Advantage plan that you could buy outside? And would it make sense to do so, right? A lot of these kind of things to think about, but really you can't really ask the Medicare agent sitting there at the store or the sales seminar person, because you may not understand it fully yourself first. And that is where we're going to start in finding the Medicare Advantage plan that's right for you. So before I go into the platform and show you how I make selections to Medicare Advantage plans based on what I hear and what my clients want, I have to make a small disclosure, which is I don't represent all the plans as you see on this thing that's been up here the whole time. If you want a full list of plans, you can go to medicare.gov or call the number. I would highly suggest though to do your own research first, because the people on medicare.gov on the phone and on the chat, they are just simply agents who help you navigate the system. They are not Medicare insurance licensed agents that can help you with the individual plan, and also after you enroll in the plan, they are not going to be the ones to help service you like me or other independent agents out there would be. Additionally, if you do wish to call, you will need to use this number here, because this number here is the call recorded line. As of now, October 2022, all calls have to be recorded when it pertains to Medicare plan enrollment or any kind of, they call it a process that would lead to a plan enrollment. So that's any kind of sales calls or inquiry. If you want to talk via email, that's fine as well. My contact form information is located down below, and just know that I am a Medicare insurance agent and I do make commission when you sign up for a plan that I recommend to you or that you sign up for with the link down below. One of the best things that this site that I use to help quote provides that Medicare.gov doesn't is you can actually see and filter through a lot of these plans by plan type, insurance company, whether or not they cover all the medications, and whether or not all the providers are in the network. Now, it is important that you check, of course, the individual companies, provider directories, and formulary, as these things can change based on the time that they're uploaded onto my search engine. But it is still, I would say, pretty much the most reliable and efficient way to take what you need and match it to the plans out there. All right. I hope you guys enjoyed this video. Again, super long intro, I do apologize. Let's get into the meat and potatoes of how to find a Medicare Advantage plan. Alright everyone, so we're going to go open up a new tab and go to matthewagudo.com/enroll. This will take you to my shopping cart page, where all you need to do to find a plan is to put in your zip code and search to see what's available, and you can even add in your preferences. If you want to, you can go and create an account, and I strongly suggest you do so if you want me to review what you put in to make sure you're not missing anything. Alright, so we're going to go to Hawaii 96814, and keep in mind it does take a little while to open up everything because there's a lot of data coming through. So in the county of Honolulu, we've got 11 Medicare Advantage plans, 3 Medicare Advantage plans with no drug coverage, 10 prescription drug plans, and if you're looking for a Medicare supplement plan, you will have to contact me directly, as these plans do need to be sold at an individual one-to-one level. Now, on to adding the preferences. So we're going to pass through all of these filters, then we're going to go to preferences, and we're going to add some preferences. Now for this example, we're going to look for a medical and prescription drug coverage, or an MAPD plan. If any of these apply to you, make sure you click it. If it doesn't, then no, I'm not eligible for any special assistance, which I believe would probably be most of the people watching this video. We're going to continue. Now here you can kind of estimate your health needs or your health costs. And this one I'm going to put no, simply because the current estimation tool is not working correctly. So we're going to go and continue, and pretty much with the tools that you learned from my book and also the tools that I'm going to kind of go over here, you will actually be able to figure out where your high cost services are going to be. Alright, so let's go and add the doctors. Remember that network inclusion? Do you need your doctors in the network? Most likely you do. So let's go ahead and add a few. We'll go add Bautista, Rayner, and let's go and add somebody, another doctor. We'll go with Dr. Lee. We may not be able to find it. There's so many doctors here. Here we go. And make sure you click the right location for him that you want. I'm going to go with Punahou. Continue. Now we can go and add our drugs. So this is a very important part here. What I would do is, instead of connecting to mymedicare.gov simply because it's difficult to get the current list, I would actually input your current list. So whatever you're taking, losartan, the amount you take, the dose, the quantity per month you take, or if you take it less, click there, add that, and you can add as many medications as you take. Let's go add a cholesterol medication, and for the sake of the example, we're at an expensive medication. Alright, next we're going to find the pharmacies. So most plans cover all major pharmacies, so we're going to add Walgreens, Long's Drugs, which is also known as CVS, and then I'm going to add Walmart. Alright, continue. Now we're going to go to the plans. Alright, so in the plans area, we now have the plans, and its default is by plan premium. We don't want that. We want to default this to the total annual estimated drug costs. Okay. Now it looks like Peter Cayley may not be in any network. So I checked the Medicare.gov and the local Kaiser Permanente, as it says he's affiliated with the Hawaii Permanente Medical Group. So this Dr. Peter Cayley is a critical care intensivist. So he actually works at the hospital of a HMO hospital, Kaiser Permanente. So that's why he's not showing up in any of the plans. Also, while he does accept Medicare, you can't go to the Kaiser Permanente unless you have or you are a member of their Medicare Advantage Plan. So that's that. Now we need to plug in what kind of network we want. Do we want a HMO or a PPO? I'm going to default to PPO, and I'm going to say we want a PPO plan. And LPPO versus PPO, for the sake of this example, in Hawaii, they are basically the same. But in larger states like Texas or Florida or California, the local PPO plan pretty much just keeps you inside of your county, and the PPO plan sometimes expands the in-network to the state. So you could be paying a little bit more for the PPO versus the LPPO. If you wanted to filter by the carriers here, you can click the carriers you want to show. I personally have contracts with all 4 of these companies and a little bit more, but for Hawaii, these are the only carriers available, and these are the only carriers that I represent. If they're on this list, that means I would sign up my clients for it. So if you wanted to sign up with these plans, I would say that it would be a reputable company, and those are the companies that I typically would work with. Next, let's go and compare. So let's see, if you wanted a premium plan, we'll go with the 47, the 33 from Devoted, and the 55 from United. Let's compare these three plans and see if there's any really large differences between them. And this thing here shows the plan differences. The annual costs are roughly in line. But here's something we need to consider. Devoted is a new plan, so it's too new to be measured. Humana is a 4.5 star. United is a 4 star. So based on the star ratings, Humana has the strongest star ratings. Okay, something to think about. Put that in the back of your mind, I guess. The total annual estimated cost, this is based on plan premiums and drug costs. Remember, we took out the health. So based on the plan premium and the drug cost, the cheapest plan is the Devoted. The most expensive is the AARP. The one in the middle is Humana. These plans have no medical deductible, and the maximum out of pocket is here. And you can see all the major differences. A large difference or a large copay is the hospital. So hospitals one of the larger copays and emergency room. $90, $90, $95, $90, $300 per day up to 5 days, $325 for up to 5 days, and $300 for up to 5 days. And the way I like to think about these things, let's bring out the handy calculator. 300 times 5 days is $1,500. This is the most that you would spend for a 90-day stay at the hospital on the United and the Humana plan. 325 times 5 is going to give you what the Devoted plan would cost you for a up to 90-day stay. So that's kind of your larger outlier risk. And then the drug plans are here. This is the deductible. Only the Devoted has a $200 deductible, and these are the co-pays and or the co-insurances of the cost of the drug. So tier 1 preferred generic, tier 2 generic, tier 3 preferred brand, non-preferred, and specialty tier. These are the individual costs of each plan side by side. To view more information, you can click here. So it looks like for Dr. Bautista, he's in network for all of them, but he is in network only for the one location on the Devoted plan. So you'd have to double check. And I've double checked for Bautista, he is in the network for Devoted. Peter Cayley is obviously out of the network for all of them. So you wouldn't be able to see him with any of these Medicare Advantage plans, or at least he'd be an out-of-network provider. All these are PPOs. You could see him provided his doctor or his office agreed to seeing you. All the 4 medications are covered in all 3 plans. All of them are in network for the pharmacy. And as far as dental riders go, the only plan with dental riders is the Humana. These other plans do not have a rider, so you cannot add on more dental benefits. Now, if we go on to here, we can actually look into the plan details and learn more about them. So you can click in here. And this page, plan details, will show you more of a detailed breakdown on all the different co-pays and co-insurances that the plan might have. So here's another expensive service, outpatient surgeries. It can be anywhere between $0 and $210. And this is for surgeries where you're not admitted to the hospital, because an admission would simply be this copay per day. Additionally, ambulance is a $250 copay per trip. That's another really expensive service. If you want hearing aids, which is a non-Medicare covered benefit, you can get hearing aids on this plan between $199 and $499. This plan has a fitness benefit. If you go out of network, the charges will be higher, of course, than the in-network charge, so do keep those things in mind. Additionally, as of 2023, Medicare Part D vaccinations are at no additional cost to you. So even if you are needing the shingles vaccination, etc., you can get them for no cost in 2023. On this plan, here are the drug plan copays: 0, 0, 45, 100, and 33%. And here are the summary benefits in different languages that you can go ahead and click, the full application, and of course the provider directory, prescription directory, pharmacy directory, and the dental riders. Okay, that's the plan details. Now we're going to go one step further into the prescriptions. So this is very, very useful. So this tells us what the drug tier is. So this is preferred generic, which are tier 1 medications. Tells you how much the retail cost of the drug is at Walgreens, how much you pay before the gap during the initial coverage phase, how much you pay during the coverage gap, and how much you would pay after the coverage gap. And it does change if you change the pharmacy. Okay. So here's the expensive medication, Jardiance. Its retail cost is $610. Before the gap, it's $45. During the gap is $152, and after the gap is $30. Now, where can we see an estimated cost of all these things? Well, we find it here. So, this is the total estimated cost with the drug and the premium, because we are not estimating the health cost. So your first month, you pay nothing for these 3 medications. You pay the premium, and you pay the $45 copay for the Jardiance. That remains the same until August. In August, you'll be paying $114.90 for Jardiance. And then from September through December, you are paying the full $152.73 for Jardiance. So it is going to get more expensive if you are on Jardiance, because you will get into the coverage gap in between August and September, and you don't get out of the coverage gap during the year, so you won't be paying the after gap fee of or cost of $30 that we saw right here. So you don't reach the it's called the catastrophic phase. You will not reach that if you are on Jardiance. So that is a simple way to figure out the high cost items on the plan, your drug costs, and your doctors. So if you wanted to enroll, you would simply add this to your cart, just like you would anything else that you were purchasing online. You would find out if you want to add one of these riders if you want to. If you want to learn more about the riders, I did a video on it, and you can go ahead and request that video from me, as that video is not going to be on the public domain. So you could change plan, remove plan, or view details here, but we're just going to assume that we're enrolling. We would continue to apply, and then here you would add in all of your information. So we'd continue on that last screen there. And you just simply type in all the information. And again, you cannot progress unless you put in everything. So the next page, it will show you your beneficiary information. So we're going to need your Medicare number, information on the Medicare card, when you want it to start. So this is going to be AEP. This is the earliest you can start on it, and if you're going to have any more prescription medications. For this one, I'm just going to type in anything that I next. And then since this is a PPO, you don't have to do this, but if you are in a PPO, you will have to select one, and it will automatically, when you type in click physician search, it will take you to the plan, in this case Humana's Physician Finder. You could type in Medicare insurance and the coverage type for 2023, and we're going to choose the Medicare PPO network. And there he is. Let's go and search. And here he is. So there's the primary care number. And what you need here is the provider ID, which we pasted in there, and the primary physician, which would be Dr. Bautista. And if you're new, put yes. If not, put no. Now for paying, you can either pay electronic funds transfer, which is a deduction from your bank. You can have it automatically deducted from your Social Security check or your railroad retirement benefits check, or if you want, they can invoice you. You can choose the language. And now here you would need to submit the information. Make sure everything is correct. Here you would say that you understand that your signature is your consent to enrollment. And if you are completing this for yourself, you click here. If you are not, if you have a power of attorney, you're completing this for a family member or you're a legal representative for someone, you click here. And then this pretty much says if you want Humana and subsidiaries to market to you. I usually put no here, no. And then you do not want to share anything. And then you would submit it here. And if you were to submit it now, that would be a enrollment process. If you wanted to enroll, or if you made a mistake and you're watching this and you're trying to remember how to do this, if you enroll in another plan, let's say you submitted this today and tomorrow you're like, wait, I want to enroll in another plan, you just need to submit another application. And the last application that was submitted before December or on December 7th will be the one that you are enrolled in. So for example, today is October 24th. If you submitted one today and then you submitted one tomorrow or next week, then the one you submitted tomorrow or next week would be the last plan on record as of December 7th, and that is what you will be enrolled in. So if you made a mistake, don't worry. You still have time to actually change that if you wanted to, right? Thank you for watching. I hope this helps. And then you guys have a great rest of the day.